Hi, my name is Debbie Stevens. I'm the director of the CLL program at the University of North Carolina, and I'm pleased to be joined today by Dr. Jennifer Woyach, who is the section head for CLL and the co-director of the Leukemia Research Program at The Ohio State University. Thank you so much for joining us today.
Oh, thanks for having me.
Today, I'd like to talk about some research that you presented at the ASH meeting in 2023. The specific abstract I want to talk about is one entitled Pirtobrutinib and Post-Covalent BTK Inhibitors for Patients with CLL and SLL, with 30 months of follow-up and subgroup analysis, which is a follow-up from the phase 1/2 Bruin study. First, could you tell me what exactly is Pirtobrutinib and what are the covalent BTK inhibitors?
Sure. So pirtobrutinib is a selective inhibitor of Bruton's tyrosine kinase, or BTK, and it is a reversible inhibitor of this protein. So, we're much more familiar with drugs like ibrutinib, acalabrutinib, and zanubrutinib, which are all covalent inhibitors of BTK, meaning that they bind to BTK in an irreversible manner, so they never let go. And obviously, these drugs work very well, but some patients will eventually develop resistance, usually through the CLL cells mutating BTK at the site that the drug binds, so that the drugs don't bind as well anymore. So a non-covalent or reversible BTK inhibitor like pirtobrutinib can come in and be effective even in patients whose CLL has progressed after the covalent inhibitors, because it binds in a little bit different manner.
Okay, this sounds like a great drug, and I think this research was very timely because this drug just got approval from the United States Food and Drug Administration to be marketed for folks with CLL. What particular folks with CLL can get this medication?
And so the current accelerated approval under the FDA is for patients with relapsed or refractory CLL who have been treated with both a covalent BTK inhibitor and with a BCL2 inhibitor like venetoclax.
Okay, perfect. And so your abstract specifically talked about folks that this would apply to. So tell us about your abstract and why this longer follow-up is important.
Yeah, so again, this is follow-up of the phase 1/2 Bruin trial, which was the first study of pirtobrutinib in people with CLL, as well as a lot of other B-cell malignancies that we're not going to focus on today. But with this extended follow-up, we see that the median progression-free survival for this drug is a little over 19 months. The thing that it is kind of unique about this particular follow-up is that we then looked at patients in two different subgroups, those who had previously received drugs like venetoclax, BCL2 inhibitors, and those people who had never received a BCL2 inhibitor before. And so, as you mentioned, the patients with a previous BCL2 inhibitor exposure are the ones who can currently receive this under the approval from the US FDA. But also here, we're looking at those patients who hadn't received that drug before. And what we see is that both groups respond about the same. So the response rate is over 80% in both of these groups. However, the time that the patients remain in remission, the progression-free survival, is a little bit longer for patients who have not received venetoclax before. And, this may just be a function of receiving less lines of therapy prior. So we know that people who have had less treatment tend to have longer remissions to most of our therapies. And the people who had received venetoclax had also sometimes received a lot of other therapies that the people in the other group hadn't gotten. But I think importantly, this tells us that this is a drug that we should really continue to investigate, even in the setting of people who have not yet received venetoclax.
So that's good information, and it kind of follows along with what we've seen with other drugs, that the more treatments you have for CLL, the shorter time you have before the current treatment stops working. However, it is really encouraging that it does work for patients who have had these drugs, and that is represented by why the United States FDA decided to approve this drug. I think it's a great breakthrough for patients. What kind of side effects do you see with this drug?
And so pirtobrutinib is a really selective inhibitor of BTK, and it is extremely well tolerated. So side effects that we saw in patients on the Bruin study, a lot of them are kind of common things that you'd expect to see in anybody who is on a trial for over a year. So, some people had upper respiratory symptoms, sometimes people had coughs. There is some bruising associated with pirtobrutinib, which is something that we've seen with other inhibitors of BTK. It's not clear yet that there's going to be a signal for any of the other toxicities that we associate with the covalent inhibitors. So the rate of atrial fibrillation was relatively low, rate of hypertension was relatively low. But those are side effects that will obviously be continued to monitor when we get to larger and larger studies.
So that's great. Sounds like a drug that works really well in folks that have had multiple other prior treatments and has pretty limited side effects.
Mhm.
It's great that this drug is available for patients potentially through prescription. But what about this particular clinical trial? Could patients still participate? And if not, is there any other option to participate in clinical trials with this drug?
Yeah, that's a great question. So this particular trial is not accruing more patients anymore, but there actually are a number of different ways that people with CLL can get pirtobrutinib as part of a clinical trial. So there's a few phase 3 trials that are still accruing patients. A couple just off the top of my head. One is comparing pirtobrutinib to ibrutinib in patients who have never had um, a covalent inhibitor before, and I think this is still enrolling some patients with relapsed CLL. And then there's a study looking at pirtobrutinib plus venetoclax plus rituximab, comparing that with venetoclax plus rituximab. So those are two kind of phase 3 trials. There also are a number of smaller, like investigator-initiated studies that are going on around the country. So it's definitely worth a look on clinicaltrials.gov to see whether there might be a pirtobrutinib study open near you.
Well, great. I think this is really exciting research, and thank you so much for doing this work. And thanks for being here today to talk with us.
Thanks so much for having me.